Over 20 women die a day from prescription opiate overdose. We are in the midst of an epidemic in the United States. The CDC has been speaking out about prescription opiate overdose and the effects and the toll it's taking on our nation. The FDA has recently issued a black box warning about the risks associated with opiates. We need to understand that there are alternatives. We need to understand how to utilize them, and we need to educate our patients about why they're important and to show them that they work.
Over the years, what we realize is emergency physicians frequently misjudge pain. They'll overtreat, they'll undertreat. And it was our goal here at St. Joe's to create a pain program so that we become the leading experts in managing pain in the emergency departments.
The Alternatives to Opiates program came about with the purpose of educating and providing alternatives to opiates for our patients. The ALTO program utilizes interventions such as trigger point injection and nerve block to control patients' pain completely in a way that opiates cannot. But also, if a patient does require opiate prescriptions for pain management, we appreciate the need for education and to make the patient aware of the potential for addiction.
Patients who present to the emergency department who require opioids for either cancer pain or pain not relieved with other modalities will get the opioids that they need. But our goal here is to first treat them with alternatives. And if the alternative therapies work and the patient gets complete pain relief, then our job is done without using toxic substances.
Through lectures and hands-on simulation labs, I was able to educate our physician staff, and the program went live on January 4th. Our staff has done a beautiful job at implementing it. We have almost 300 patients in the past 2 months who have gone through our protocol, and the preliminary data is compelling. Most of our physicians are reporting superior pain relief to opiates, a significant reduction in opiate prescribing habits with no gross change in patient satisfaction.
I was having a lot of pain in my right upper shoulder. I had a stiff neck. I couldn't even move. My back muscle was very, very tight, and I was having what was called a muscle spasm, something that I've experienced before. That I was prescribed pain medication for, a pain pill, that I just didn't like the side effects like grogginess and nausea, just feeling uncomfortable and not like myself. So Dr. LaPietra explained to me that there were alternatives. She said that she could do some trigger point injections, which I had never heard of before. I was nervous because I don't really like to get needles, but then I felt the needle go into my back. I felt the muscle quiver, and then all of a sudden she told me she was injecting the medicine, and I felt nothing. It was such a relief. I actually felt instantly better. Dr. LaPietra made me feel much more comfortable, alleviated all of my concerns and the pain that I was having for the past couple days. She gave me medication to go home with. She explained how the medication should be used and how it would continue to help alleviate the discomfort that I was having.
We've had such an outpouring of support from the entire House of Medicine. The American Medical Association has supported our program, the American Osteopathic Association, American College of Emergency Physicians, and I do believe that this will become a model of care, not only now at St. Joseph's, but in the future across the country.
I believe in the strength of this program. I believe that the patients who have gone through the program have had excellent pain relief, and it is empowering to the physician to have options and alternatives.
If I ever had to go to the hospital again, I would go back to St. Joseph's because I think it's great that they're giving their patients an alternative and a choice on how they should be treated.